Dr. Shirley Hartman. I'm a family physician in Jacksonville, Florida, in one of the areas in which I specialize is in Lyme disease.
What do you think about ivermectin?
Ivermectin is fabulous as an anti-parasitic. It's an excellent antiviral. It works for COVID virus, for Epstein-Barr virus, for colds, flu, and other viruses. Ivermectin even seems to have some anti-cancer properties. It's very difficult to get prescriptions of ivermectin these days because most of the pharmacies will not fill the prescription, certainly not for COVID. Most insurance will cover for ivermectin. It's been blackballed, but there are
and it's so expensive in this country.
Right. There are probably 60 or 70 studies showing phenomenal benefit of ivermectin with little or no negative side effects. So it's an extremely safe medication. It can be obtained from veterinary supply houses, but there are also Canadian pharmacies where you can get ivermectin. So my favorite that doesn't even require a prescription is alldaychemist.com. So you can get 100 of the 12 milligram ivermectin for $125 from All Day Chemist. Ivermectin can be used for prevention of COVID. So it can be used as a dose twice a week, and the dose is going to depend on weight, but for most people, 12 to 24 milligrams is a dose, and that's just dependent on weight. So for someone that's at high risk for COVID, or that's in a higher risk occupation like a nurse, then they can take ivermectin twice a week, and it's highly effective for preventing COVID. You can also use ivermectin in high risk situations such as large gatherings of people, weddings, flight on a plane where there may be 500 people on that plane. A conference. If one person on that plane is in the incubation period for COVID, that exposes everybody on the plane. So I'll typically suggest that people take a dose of ivermectin before getting on the plane, and again 2 days later. Now you can also use ivermectin to treat COVID, and then it's a dose, which is, like I said, 12 to 24 milligrams for adults daily for 4 to 7 days. So my recommendation to people is to obtain the ivermectin ahead of time, so that if you were to come down with COVID, or a loved one or a friend were to come down with COVID, that you have the ivermectin available. It's also very effective as an antiviral. Okay. And many Lyme patients have high viral loads. So not only is the ivermectin going to help lower that viral load, but some Lyme patients have parasites that hold the biofilm together. So when you eradicate the parasites, the biofilm breaks down, and now all the Lyme, Bartonella, and Babesia inside the biofilm dies because it has no protection left.
No. Is that you kill me because you say all the things that I want to hear from a doctor. So thank you, Dr. Hartman.